There's a clear link between spirituality and heart disease, quality of life and life satisfaction. Caring for your heart is caring for your spirituality. From my experience in the hospital, patients often have very intense emotional and spiritual concerns that are often far more dire than even their heart conditions. Several research studies indicate that not only can spirituality improve quality of life, it can help support caregivers and potentially help heart failure patients from needing to be readmitted to the hospital. One study notes it's likely that people suffering from coronary heart disease have a lack of understanding of their emotions and score low in questionnaires assessing emotional intelligence. They don't have the ability to stop and think before acting and to pause and consider the best course of action in the present situation. Hostility, anger, or other uncontrolled negative emotions relate to multiple behavioral risk factors, including smoking, alcohol consumption, sodium consumption, and exercise behavior. Recently, I spent some time with a 52-year-old white male in the coronary care unit at the hospital. He was diagnosed with congestive heart failure and had an ejection fraction of 15%. Basically, that means that his heart was only pumping out 15% of the blood with every heartbeat, which means his heart was very sick. 30 years prior, this man's family suffered a home invasion when he was not there. I spent time with him. He was seething with rage, unforgiveness, bitterness, and anger. He asked me questions like, "What would you do if it were your wife? Wouldn't you want to take revenge?" What was initially so much anger and meanness on his part, much more this man was struggling greatly with grief and mourning. Grief both with the home invasion and murders, and some grief with coming to terms with the seriousness of his condition. "I'm not ready to die if that's why you're here," he said to me. I spent time with him working on Warden's Task 1, accepting the reality of the loss, which involved probing questions, compassionate presence, and support in that first task of mourning, accepting the reality of the loss. Over the last 8 months at the hospital, the staff in the cardiovascular units have also been a great focus of mine. In the cardiovascular ICU, there was a code blue with a CVICU patient, which means that the heart of the patient stopped beating. 30 plus staff members responded and flooded this small unit. The patient was resuscitated successfully, and the patient remained in the CVICU. After everyone left, the nurses remained and returned to their patients. The staff was physically and emotionally tired. Compressions are physically demanding, and the emotional and spiritual focus required during a code blue takes a toll on a person. From my experience with trauma-informed care, I noticed this high stress, anxiety, fear, heightened awareness, and fatigue in the nursing staff. I intervened with them by providing tea for the soul about 2 hours after the code, which cared for the physical and emotional replenishment through warm coffee, warmies, fidgets, and debriefing the staff through affirmation and releasing their anxiety. As I've spent time with patients and families in the cardiovascular units, I became curious these last 8 months. As I specialized in care for these patients, I wondered about what was going on in some deeper ways. The physical distress of a major heart condition or disease are what brings these patients to those units, but my job as a chaplain is to attend to the spiritual and emotional needs of these patients. I've been tracking many shared common stressors, which I would describe as a hardening of the heart. Physical distress is common in the form of pain, mobility limitations, shortness of breath, and suffering. Emotional and spiritual distress are also present in the form of fear. fear of sudden death or fear of dying on the table during surgery, regret, unforgiveness, bitterness, sadness, doom, despair, quality of life, life satisfaction, and suffering. In many studies, grief, anger, depression, chronic stress, and a lack of emotional intelligence have been linked with leading to negative heart outcomes. In other words, there's a connection, a correlation between the emotions or spirituality of humans and heart health. As a chaplain, I think theologically about the heart. As a Christian, I turn to the Old and New Testaments of the Bible for sources of understanding and meaning making. The Bible talks a great deal about the hard heart. Exodus chapter 7, verse 13, "Still Pharaoh's heart was hardened, and he would not listen to them as the Lord had said." Proverbs 28:14, "Blessed is the one who fears the Lord always, but whoever hardens his heart will fall into calamity." Hebrews 3:13, "But exhort one another every day, as long as it is called today, that none of you may be hardened by the deceitfulness of sin." Hardening of the heart is a theological trope of stubbornness, rigidity, and not listening to God, and a turning away of the things of God. By contrast, softening of the heart involves leaning into the things of God, following God, and going to God with the fullness of life. A tender heart, the Bible says, is one that is kind to others, Ephesians 4:32, and it's open to be a conduit of God's love for themselves and others. The Bible also says that a heart of flesh is to walk in God's statutes and keep God's rules and obey them. That's Ezekiel 11:20. My role as a chaplain, and really anyone's role in wanting to soften the heart and improve heart health, involves spiritual and emotional care interventions. Here are some of those. First, supportive presence, compassionate presence, and active listening. These are technical terms that means merely just being with someone and listening, really listening and validating what is being said. That has so much power to heal. Next, exploring full emotionality. Instead of bottling up emotions, spiritual care helps to express the fullness of emotions. Long-term care is increasing emotional intelligence. Negative emotions are positively and significantly associated with cardiovascular disease risk. There are 3 helpful emotions from Destino: gratitude, compassion, and pride or perseverance. Also, working with meaning making, asking and answering the deep questions of why. What does this mean? How do I make sense of what is happening to me right now? These help open up possibilities for meaning making from our situations to help integrate what's going on with us and to us into our life as a whole. Bottom line is that spiritual care is a key component in holistic care. When we attend to the physical, emotional, intellectual, social, and spiritual needs of patients, families, and staff, these are holistic care of the fullness of who people are. Integrating spiritual care into the comprehensive treatment plan can provide emotional support, improve coping mechanisms, and increase overall quality of life. In other words, spiritual care increases heart function. There's been a parallel process for me these last 8 months. As a chaplain, you realize that the people you're most drawn to are the people who are most like you. While I'm working with patients, families, and staff in improving emotional and spiritual health through exploring and expressing fuller emotionality, I'm also working or allowing God to work on my own emotional fullness and expression. As a result, I've learned a lot about myself these last 8 months. I'm learning to be more available and vulnerable with myself and my emotions, more compassionate of myself, more accepting of my humanity. I'm learning to be more expressive in the fullness of emotional expression, more willing to share. All emotions can be good. I am grateful for the experiences in the cardiovascular units at the hospital. There's a beautifully perfect and divine timing in my work in the cardiovascular units and my own growth and learning. And I'm thankful for that. This video is a little bit different this time. Normally I'm at the hospital. Today I'm at my home on a rest day. So if you're curious about any of the studies that I've referenced in this video, they're in the description if you want to learn some more. I'd love to engage in dialogue with you in the comments if you've got more questions, more insights or thoughts as well. As we leave this time together, I would ask that you accept this blessing, my friends. May God bless you as you live more fully into the emotionality that God created inside of you. May you realize that all your emotions are emotions that can serve and help you become more healthy and more fully human, living more fully into God's image inside of you. So may God bless you, and see you later.